You're listening to the Sick and Good podcast. My name is Dustin Messick, RDN. I'm a cancer survivor.
My name is Dr. Colin Goodwin, and I'm a cancer survivor. We're discussing topics related to cancer treatment and recovery while promoting wellness.
To find a balance between sick and good.
That during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regimen.
Joining the conversation today, Dr. Michelle Doose has a PhD in epidemiology from Rutgers School of Public Health and describes herself as a scholar advocate working towards health equity through better care coordination for cancer survivors. She brings her lived experiences being a childhood cancer survivor and her professional experiences having worked as a bilingual health educator, helping adolescent and young adult cancer survivors navigate health, wellness, and health insurance after a cancer diagnosis.
So I wanted to just at this time welcome Michelle to the podcast and thank you for your time.
No, thank you. I'm quite excited to speak with you too today.
Well, I wanted to perhaps start the conversation by just asking what has motivated you to pursue your career path.
Wow, that started back in 2007. I was actually sitting in a research meeting. I was working on my master's in public health, and they were going to come talk about cancer survivorship. And then we had this presenter come and speak about the long-term effects that childhood cancer survivors can experience. And in fact, that for many childhood cancer survivors, they can have health effects immediately during cancer treatment, or they may come up 10, 20 years later. And I kind of sat there in this meeting and I was like, none of my doctors have ever told me this. And I actually had just moved my primary care doctor to a different doctor because I was going off to college. And they didn't know how to follow me and what could be these health problems. And so from that moment on, I decided that this is an area of research that I wanted to make a difference in, and really making sure that not only cancer survivors know how to take care of themselves and how to advocate for their health, but thinking too, how can clinicians and healthcare professionals know how best to take care of cancer survivors? It's not only cancer survivors not knowing, it's also clinicians not being aware that there are health problems that can come up many years later. So that really struck me back in 2007 and really launched my career to really advocate for cancer survivors.
You also published an opinion education piece in Scientific American on coordinated care for cancer survivors. Can you tell us more?
Definitely. So I was working on my PhD in epidemiology, and I was I was part of the Robert Wood Johnson Foundation Health Policy Research Scholar Program, and it's really trying to really help doctoral students from underserved backgrounds learn how to translate their research to really impact policy. And so for me, I can run these analysis and regression and look at what are the health outcomes or process of care for cancer patients. But for me, I was really passionate about is how can cancer survivors get their best care, and what is the health system and their doctors doing for them? And so it started off as a kind of an exercise in a class, like how do you translate the research you're doing in a way that everyone can understand, and really getting it out there that, what does it mean to be a cancer survivor? When you move around from place to place, who has your medical records? Do you have it? Does your new healthcare provider have your medical records? Are they asking the right questions? What is health IT doing? You think about all the apps. I know for myself, I have my medical records on 3 different apps from my different doctors that I'm currently seeing, but that doesn't include my medical records from the past. And a lot of times healthcare systems, they don't keep your records forever. So how do you make sure that you're maintaining all the information that you need to get? So I got to do this really cool exercise of writing this up. And I had a colleague that advocated for me to be like, no, you should really publish this work, talking about the needs of care coordination for cancer survivors. And so not only did I do research and I published talking about that cancer survivors, and this is for breast cancer survivors, having better management of their other health conditions when they have a team that takes care of them. but I got to write this up as kind of like an op-ed. And so for me, it's something I always look back to kind of to remind me and guide the research that I'm doing now of how do we continue to advance the science of care coordination and think about ways that the health systems can innovate to really coordinate care for cancer survivors.
It's really interesting and actually really fascinating. I never even really thought if you switched over health insurances and maybe they might not have your most current, or if it's really far back, they might not have your history, which might be really pertinent in your care moving forward.
No, definitely. As someone who's moved around a lot for school, I requested all my medical records from when I was a child in my treatment back in my early 20s. And first, they wanted to charge me for all my medical records. And I was like, well, I actually just want a one-page summary, which are called survivorship care plan treatment summary. I just want to know what kind of chemo, what's the dosage, what are the surgeries I had. That's it. I don't really need all my records. But in fact, no one had made a summary. So luckily, the person who I requested the medical records was kind and gave me this huge stack for free. So then I was able to go through it myself and kind of be like, okay, so I've received vincristine and cyclophosphamide. And even though I couldn't get the total dosage because it wasn't documented in my record, at least I have an idea of what are the different treatments I received. But even now, like when I find a new primary care here, and we check off on my cancer, I had a history of cancer, they don't ask, oh, well, what kind of chemo or what did you receive radiation? Or they're just like, oh, so is everything okay? And I'm like, I don't know how to answer that question. I guess, yeah, I'm fine. But what I really would like you to ask is, do you have a treatment summary? Is there anything that I should be monitoring long term? Or what are actually the chemotherapy you received and the total dosage? So, based on the care guidelines, there might be something that we need to follow more closely. Yeah. So get to learn that from personal experience, but I know this is unfortunately true for many cancer survivors.
Oh, yeah. I think I was just going to jump in. I mean, I recently just had moved and switched dentists, and even just with, specialty care, there's that long list of treatment surgeries or histories that are needed to be added to just a quick questionnaire to then get to know the patient. And I've had that same experience where clinicians have just specifically gone like, oh, so I see you've got this history. Are you good? That's really the only question they want to ask is like, well, are you still in active treatment? Does this affect you currently?
Yeah, I love that. Are you good? It's like, sure. I never know what to answer with that. I'm like, yeah, I'm good. I'm not in active treatment. Or they're like, are you seeing an oncologist? And I'm like, but who? Because I've gone to adult oncology and they're like, we don't know why you're here. We don't treat pediatric cancer survivors and peds. Depending on your health, when the health system I was in, when I turned 18, they're like, goodbye. We're handing you off to adult oncology. You cannot be seen here. Other centers may, keep you up until you're 30. But yeah, it's like, where do you go next? And yeah, just asking, are you good? I'm like, okay, sure. Yeah, I'm good. And I'm here.
Yeah, it makes me wonder what they would say if you said you weren't good.
Yeah. And I think that's when it's like, okay, do you want to go to adult oncology? And again, just given my experience, I've seen the two adult oncologists that they don't know how to follow at least, childhood cancer survivors. Or for me, they're like, well, we don't know how best to have back issues. There's something in your back. It's not growing. We don't know what to really do. So maybe just do an MRI every 2 years. But that's not really based on the science. And luckily I have health insurance to cover MRI. But if I didn't, it can be very pricey. And I know some years the copay has been like $400 for the MRI. So, so you're kind of like, okay, we're doing what they think might be best. But I always wonder, do they consult with their colleagues in peds to ask or not? And the good thing, there are survivorship clinics throughout the US. And so those are always an option too. They usually have big academic centers. And so it depends on your insurance and having access. But sometimes there might be a good place to start to even just get a treatment summary, a survivorship care plan, or just know, like, is there anything special I should be looking in, being followed long-term for my health.
Mm-hmm. I'm actually really curious. How did you hear about survivorship programs?
So I started off when I was doing that research program and learned about survivorship care. I actually reached out to a pediatric oncologist and started off as a volunteer to work with their childhood and teen young adult cancer survivors. And then when I finished my master's in public health, I was hired as a research coordinator / health educator. And so that's really where I learned about survivorship care plan, because I was working on my master's in public health at the right place, at the right time, and then was able to work for almost 5 years talking with young adult cancer survivors of how do you advocate for your health? What do you do when you turn 18 or 21, you lose your health insurance? And this is before the ACA, the Affordable Care Act, when I remember for myself, it's like, if you were in school full time on my parents' insurance, you didn't get your cut off health insurance. And then sometimes, that meant, at least for me, going to take a year off to travel the world. Not that I could afford it, but I just had to make sure I always had health insurance. So working with young adults to be like, okay, what are different ways or what companies can you work for to make sure you can get health insurance back in those times? So yeah, that's how I got started learning about what survivorship care plans are. And I know there's some online, and there's also the Children's Oncology Group. So they have a lot of resources for childhood cancer survivors. So you can create your own survivorship care plan or work with your doctor. There's great resources to, what are ways that, you can take care of your health.
Michelle, you had mentioned that you have several different apps that you use just to then manage and perhaps communicate your personal health care. But I'm wondering what can be done within a healthcare system to do better for cancer patients, or perhaps what can a healthcare system do to be held accountable?
No, that's a great question. And I think right now, from like a health policy perspective, there's these new care delivery models or payment models that are looking at accountable care organizations or how different clinicians are being paid based on health outcomes. But I think a lot of it's really focused on cost of care for payers. So thinking about Medicare, Medicaid, health insurance, and not thinking about cost of care from the patient perspective. And really, even though they've looked at kind of quality of care, they haven't. It's more like, how can we just reduce costs? So yeah, focus more on cost. This is where I think for me and where I got excited for research is, how can the health system coordinate care better for cancer patients and survivors? And then how do you hold them accountable? How do you make sure that records are being shared? Or if I go from one health system to another, why is it so hard that the health records may not be able to be shared? Sometimes even within the same health system, they use 2 or 3 different health records. So if you're on the outpatient side seeing your primary care doctor, but you have to go to the ER and they can't talk to each other, they may miss important information. And then the burden's on you as the patient to be able to communicate your current health status. So thinking about, the role of health IT, thinking too, when you think about your care team, a lot of times maybe the clinician you see may not see themselves as part of a care team. They're not going to be like, well, you may see 4 different doctors, but I'm cared about. They don't think of themselves as part of a care team, but I do. Like my 4 doctors, they're my care team. But how, who's the leader? Who's in charge of making the ultimate decision? Do they actually talk to each other? A lot of times there's gray areas. We don't know what the best avenue or best way to maybe deal with A, B, or C. I would want my care team to have that discussion, or, thinking about like tumor boards where they can come together and discuss, what's the best care available. So thinking about what are ways that they can facilitate that communication, collaboration, so you feel like you're getting the best care, that one treatment is not having unintended consequences due to another treatment. So I wish I had a better answer of like how best to hold health systems accountable. I think payment models are trying to get at that. So I think we'll see what comes on the horizon, but I think that's what's really hard. Even as a patient, I always say the burden falls on you to make sure that you're talking to your care team and you're getting the care that you need, and you follow up on your appointment, even when it's hard to schedule everything.
Yeah, I definitely can relate to what you're saying there. Between doctors, do they ever talk to each other? It almost made me think that I wish there was like a person that kind of took all of what different doctors said and kind of brought it together for the patient, or just even to present like, here's all the facts from all the team. in like some kind of like objective way so that the patient could just like kind of like think, because like one doctor might say the opposite to what another doctor says. And the patient's kind of like, what treatment should I do next? Or like, what's the next step?
No, I mean, that's definitely happened to me, or this disagreement, and you just want, you really want that clarity. You want all the experts in the room to answer those questions and to come up with the best care plan. And it's hard. Like, we totally get it. You have those 15-minute appointment slots, and clinicians and the care team members, have a lot going on in clinic, but how can we optimize care delivery, care coordination in the health system, especially, when we think about all the technology we have today? And I don't have the answer, but, I think pressing these questions as cancer survivors, we think about health policy, pushing systems to be held accountable, to make things more efficient and easier for patients.
And you also mentioned like when you transfer of care, how there can be an issue with medical records. I'm curious, do you have any suggestions for like navigating a transfer of care?
That's a great question. You can always ask for a summary. Can you summarize in a letter kind of your role, kind of medical history? What have we done? So that when you go to the new clinician, you're not duplicating services and efforts. Because then a lot of times that's extra cost copays that you have to pay as a patient. So just asking, I think definitely getting a copy of your medical records, but sometimes, your new doctor may not look at all those records. So just asking your new clinician, hey, can you just summarize kind of history, care plan, what was done, what worked, what didn't work, so that when you go to the new provider clinician, you can have those discussions of this is where we're at and this is what worked and didn't work. I think that always helps. So you don't have to duplicate services. And I know for me, like I've set up doctor's appointments, and usually my first visits, like I'm just here to tell you my medical history, and then we can meet again at the next appointment to do care, or a checkup, because that 15-minute visit slot that you have, I'm like, I really need to just tell you, here are my records and go over everything. So that, that might be one avenue to help.
That's really helpful. Just like the summary, having that ready. Because when I was doing my cancer treatment, it was like actually the transition between when electronic medical records became available, like they were just starting to do that. And even with every doctor that I saw having just access to these records, most of them just would ask me the same questions. And then, and going through chemo and or even just the diagnosis process, it can be very exhausting for from a patient perspective to be asked the same questions over and over. So I think that having that like paper summary would take a lot of the stress off, because you've already done this before. You're like, oh, let me just read this paper. Like even like the dosage or like different chemo drugs, I think the average person like doesn't know. They're just like, oh, well, right? You're the doctor. Sorry, I actually don't have that here. I mean, I guess we could try to get a release of information from your last doctor. But yeah, it could be just really exhausting.
Yeah, I mean, that's the advice I used to give working with our teen young adult cancer survivor. It's like sometimes it's also exhausting as a patient to repeat your medical history. Like, I don't want to talk about what happened to me when I was 2, when I'm worried about stuff about today. But then there could be stuff that I'm dealing with today that's actually goes back to, the treatment I received a long time ago. So just having that summary so that you can tell the doctor, look, I'm tired of talking about it. Here it is. Here's all the surgeries or treatment I received and the dates. Let's start with that, and then you can ask more questions. But like you said, it can get exhausting, to be asked those questions over and over again. And just, having that 1 page or 2 pager just to help summarize it. I feel like that mental task on you as a patient, it helps. But I know even for myself, it's like, oh, I know they're going to ask about my cancer history. What is this going to mean? What do we have to talk about? And sometimes you want to avoid it. I know sometimes with new doctors, I've kind of just avoided the conversation because I don't want to go there. But I got to remind myself, nope, they need to know my whole history, and that could help.
I was just going to say that I think you bring up an important piece that oftentimes a doctor has a limited window to then have that appointment and visit completed. And so what amount of time needs to be spent on going over your history to then get a sense of what is the best course of action of care in the moment. And sometimes it might be pertinent, and some other times it might not necessarily, like you said, be worth mentioning or even avoiding, and kind of having that be like some mental gymnastics in a way to then decide on what is shared and what is not. Well, Michelle, I wanted to ask about maybe some accommodations for services for minorities. I know that you have worked as a bilingual health educator, specifically working with cancer survivors, adolescent and young adult cancer survivors to navigate the system. So I'm curious if you could just speak to that for a moment.
Yeah, definitely. I think, for me, I've been very passionate, as a scholar advocate on addressing health disparities. A lot of times, we have research, and I've done the research, saying for minorities, and this can include racial ethnic minority, Black, Hispanic individuals, or cancer patients living in rural areas, or social, maybe not having the economical means to pay for health insurance, thinking about those different groups that, may need extra services or care, or the services or assistance to interact with the healthcare system. A lot of times, so that's really got me excited to do the work that I do, is to think, okay, we know that, think beyond the patient, but how can the healthcare team and health system really work to optimize the care for patients? And that may mean for rural patients that have to drive 2-4 hours to the oncology clinic or primary care doctor. What is the role of telemedicine? I know for when I worked as a bilingual health educator, sometimes it's how do you get health insurance when there might be issues with your immigration status? And so what type of, insurance is available for you? Or if you don't have the economical means, you are working, but you can't work full time, how is it to sign up for Medicaid or perhaps other insurance that the state might offer? And a lot of times individuals may be working 2 or 3 jobs and they can't take off the time to go see a doctor or wait in the clinic for several hours, because we know sometimes things happen, get backed up. You're not going to go in for 15 minutes. You're like, okay, it's going to be 2, maybe 3 hours of my time to get there, to wait, to be seen, to do all the labs. And thinking about the social needs of individuals that, it takes a lot to get there, the transportation, the time off, and perhaps the childcare services that you need. And so for me, it's really thinking about the health system, or not blaming patients for not getting the best care. Like, I never like the word like non-adherent. Patients are just non-adherent with their care or doing what they need to do. And a lot of times people are trying to juggle a lot, their health, their work, their family, their friends. And sometimes the worst thing going on in someone's life is not their health care. It's making sure there's food on the table. And so if we really want to meet patients where they're at, how do we make sure their social care needs are met so that they can focus on their health? And I wish I had answers for these, but I think, there's these new innovations and research being done to understand and come up with different ways that we can meet the needs of patients so that they're getting the information that they need in a way that they understand. They can get services. The role of telemedicine, so you don't have to drive. I find it convenient that if I can just jump on a video chat from my doctor for a specific health issue, I don't have to take time and drive and sit in the clinic for minor things in between, maybe my yearly physical. So thinking about this innovation to different strategies that would work for different patient population based on their needs.
Yeah, I'm a big fan of telehealth. Just in my field, I really do feel it helps with that access to care. And within my healthcare system, we have the opportunity to then include an interpreter if needed through telehealth. So I think it's just sort of streamlining that process. And I think that is an example of perhaps a way to have that accommodation and services for those who are a marginalized or a minority group, or just need to have those communication bridges built. And yeah, I'm just wondering if you could speak a little bit to the cancer research that you had mentioned earlier, just having that participation.
Yeah, no, I'm like, again, I call myself a scholar advocate, but I think we need cancer survivors or individuals with a history of cancer to be involved with research, and not to be just participants, but to actually say, hey, we need, we need to understand these health effects. We need better care coordination, or we need like a better app, like you said, the telemedicine and having an interpreter. We need those services, and what's the best way to optimize care delivery. And I'm a big proponent for, community engaged research. So thinking about community as community of cancer survivors, working with researchers to come up with the research question, to identify what are the needs, the gaps, the opportunities. How can we work together to address the care needs of cancer survivors, but also make sure if we come up with something that is sustainable. A lot of times I see in research is great ideas and we show that it works, is effective. They do a randomized control trial, thinking about like patient navigation or so forth. And a lot of times those programs are sustainable. It's the first program to get cut, even though there's cost up front, but the cost savings is huge. So I think working with communities of organizations that serve cancer survivors, but also cancer survivors themselves, to make sure that when we show that interventions or programs work, the research that we're able to scale it up and make sure it's sustainable long term. And so I also, my favorite part, what really gets me excited to do research is actually when I engage with other cancer survivors. So there are different conferences that cancer survivors can get trained on being a patient advocate, but also engage with researchers. And I think I always say, hold us accountable. Are we asking the right research question? So there's opportunities, when you're thinking about different research conferences out there, definitely look to see if there's opportunities to get involved, to get trained as a patient advocate, and then to get involved as a patient advocate in different research. And even the National Cancer Institute has an office for patient advocacy. So there's opportunities, I think, to serve on these boards, like community advisory board, and give your perspective and feedback. So I think we need to be involved and be involved in research, making sure the right questions are being asked, making sure that we're inclusive of everyone and who will be leaving behind for different cancer survivor population.
The only thing I can think about is just like the sum up of kind of like some of the take homes of today's episode would be going to a healthcare provider, making sure you kind of have a summary from your previous doctor and like requesting that summary at the end of your care, as you know that you're going to another place. And then also you mentioned cancer survivorship programs. And I'm curious if do you have any like advice for somebody who's like maybe a recent survivor on like, what is it, just like Google survivorship programs, or is there an actual like department at their healthcare system that can like let them know like of programs?
Yeah, I think that's something cancer survivors can speak with their oncologist if they have a cancer survivorship program already within their health systems. I always think like, we should be talking about cancer survivorship when you're thinking about cancer treatment, because you want to know up front, okay, what are the long-term effects that could come up based on the treatment you're going to receive. So I think survivorship is something that it should be early on discussion. So yeah, definitely check to see if your health system already has a cancer survivorship program. If not, definitely you can go online and Google cancer survivorship program in your city. And there are many out there. And a lot of times they'll take the role of requesting your medical history, all your medical records from where you got care. And then they'll summarize it and give you a plan of, hey, in the next 5 years or 10 years, you want to watch out for A, B, and C. In 20 years, you want to do this regular checkup. So I think it helps having that plan in place. So yeah, definitely you can look online for different cancer survivorship program, ask your oncologist where they go. And yeah, that's a good place to start.
There are probably a million different solutions, but it's just really about cost and like what's feasible based on our current system.
Yeah, and thinking about that as an individual, the cost of care keeps going up, and your copay and staying healthy, like outside of healthcare, like paying for that gym membership or that personal trainer because you need to stay healthy, or eating healthy. That costs extra money to be as healthy as you can be outside of your copays for a visit. Or
yeah, and maybe there's even maybe there is some apps available these days that are designed to kind of help with some of this process.
They know what one doctor's doing with another. So no, I think that's great. I'm sure that I'm hoping. I mean, I know there's different innovations being out there, especially thinking about, transportation or food insecurity for cancer survivors or individuals trying to seek care. There's coming up with these new apps to connect community resources to patients. So I think thinking about, different innovation, I think the hard thing is across these different health system boundaries, if you get all your care within one health system, it can definitely make it easier. But I know I don't. And for many other patients, individuals may not get their care in one type of health system with one medical record, and makes it hard. But I would love to hear more about different innovations like this. I'm sure there's people doing it.
Yeah, there's got to be somebody. I was just thinking even about like food insecurity, like, during my treatments, we were a part of a community church, and they kind of just stepped up and started cooking like all these like home cooked healthy meals for my family, which I think really helped when you're like going to the doctor like 4 times a week. And not everybody lives close to the doctor. Like some people are driving like an hour, and just thinking. And then also if you don't say something during a doctor's appointment, they don't know. So they might not mention to you. If you're like, oh, I'm just really stressed out, like I could barely afford food, now I got to do chemo.
There are some cool technology that's coming out, and I'm blanking, of course, on their names, but I'll definitely look them up and share. It's asking those questions as a patient so that, you're getting the food and services, or just help preparing meals when you're going through treatment can go a long way for patients, but also just dealing with the burden of cancer and treatment. So it's linking those services to the clinical care.
Yeah. Yeah. I mean, the first thing I also think about is if somebody was like food insecure and they actually could think of to say that during their treatment, then like somebody would probably say, oh, well, there's like food pantries like that are local. You can get like food once a month.
And I know there's some cool research being done out there where the doctor does write a prescription to the local farmers market.
Oh, really?
Yeah. So there are different initiatives being done and being tested out there to really meet the social care needs of patients. So I think, asking those important questions, how do we bring those care needs being addressed for patients in clinical care?
Yeah, that's really cool. I wish there was more coordination of the food piece in our healthcare system. I know it's not really an essential part, but when you're doing chemotherapy, like you're not really able to prepare your own food. I believe strongly that our nutrition is a big part of healing and our well-being and having good energy. And it'd be really difficult to imagine somebody doing a lot of chemotherapy and then just having no energy. So they're just going to like whatever's quick every day. Like that's going to really be taxing and hard for our bodies to heal if we're just eating like high like foods with like a lot of like oils and trans fat. That's going to be really difficult.
But I know this is definitely on the radar for researchers, and they're trying to address this. Either, identifying community resources that can meet the needs of like prepping home meals, or thinking about like local food pantries, so I know from the research community, it's something that's on their radar, and I hope more of this type of research gets funded and developed. I definitely think it's needed. I'm
glad it's on their radar.
Yeah, and it's need more of the research to know, how will this process work and lay out, but also like the cost effectiveness analysis to show that the upfront cost will have better outcomes and cost saving long term. And so, doing that type of research and to inform policy so that thinking about it can be either a mandate or insurance companies want to pay for it because they know they're going to save money on A, B, C down the road.
Yeah, that's a good point. It's like, and these studies would take a long time, like probably like a decade of research, right? Before they could decide, okay, this is cost effective for us to implement this program.
Again, it just depends on the research questions, or looking at short-term cost savings if you want to look at during treatment and versus long-term survivorship. So I'm sure there's innovative methods out there that economists can do to kind of look at this. But yeah, I think you're right, looking at the short-term effects and long-term effects and having those longitudinal studies.
Yeah, research. There's always like, here is some of the stuff we know, but we need more research to confirm that this is the reality.
And to inform, but I think like the patient, being a cancer survivor, sharing that perspective is what needed. That's telling your story gives relevance and importance, and knowing what you went through and sharing that with researchers so we can address that. The nutritional needs during treatment, knowing that, not having the energy to prepare healthy meals. And we know, food is also healing. So I think those are excellent points that you brought up.
Well, in doing a quick little search on healthcare messaging apps, there are quite a few available.
Really?
Oh, absolutely. Just name a few. There's Backline, Health Engage, Well, Tiger Connect, Clara, a Click. So there are these security messaging apps that can be used to be communicating and coordinating your care. I have not used any of them, so I can certainly not recommend or add any statement there, but it seems like they've all considered personal health information and have been compliant with and HIPAA and other applicable laws for communicating those healthcare needs. But I wanted to just really to appreciate the conversation on the whole body approach and being able to then talk about how communication is part of, coordinated care between what a patient needs, whether that's their physical needs with their treatment, but then also then thinking about these other variables that come into play in treatment, like we just talked about, and navigating the transfer of care, or maybe even accommodating services for minorities, and really what that looks like for survivorship programs.
No, those are excellent points in communication and trust with your provider and care team, building that trust. I know even for myself, I've changed different primary care doctors because that trust or that communication of these are my goals and their goals were different, and there was no alignment of like, okay, well, I think A, B, and C is more important right now to discuss, and they were more focused on something else, eating and exercise. And I was like, well, I'm really concerned about A, B, and C. So I think it's building that trust with your care team, like you said, and that communication.
Michelle, thank you so much for joining the conversation and really bringing your expertise as an epidemiologist to the conversation here.
No, thank you. I appreciate speaking with you too, and it's exciting to get this information out there. And thank you.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey. Thank you for listening to the Sick and Good podcast. We'd like to invite you to connect with us on our social media and Instagram and Facebook accounts. We're also happy to share that we have launched the Sick and Good podcast website, sickandgood.com. This website is a place to read our bios, subscribe to the podcast, listen to full episodes, or read full transcripts, and contact us with your questions or comments. We care about your listener experience and would love to hear from you to keep the conversation going on the topics of cancer and wellness.